Hey guys, this is Anurag. Welcome back to my channel. So, in the previous video, I had discussed regarding anatomy of heart. Today, we'll be discussing regarding conducting system of heart. So, when it comes to conducting system of heart, our heart has a double circulation. One is pulmonary circulation, the other is systemic circulation. You guys know that the blood enters from inferior vena cava and superior vena cava to the right atrium. From our right atrium, the blood moves into right ventricle through tricuspid wall. From right ventricle, the blood goes from pulmonary artery. This is deoxygenated blood. From our pulmonary artery, it moves to lungs. And remember one thing, pulmonary artery is the only artery which carries deoxygenated blood in our body. Then in our lungs, these get oxygenated and they come back to our left ventricle, left atrium. From our left atrium, the blood moves to left ventricle through mitral wall. And in the end, our semilunar walls open and through our aorta, the whole blood gets circulated to our tissues. This is the way our conducting system works in the body. So, this is the general diagram of our heart. Just check over there. We have superior vena cava and inferior vena cava. From there, the blood moves to our right atrium, right ventricle, left atrium, and left ventricle. Right atrium, right ventricle, pulmonary artery, lungs, left atrium, left ventricle, and aorta in the end. So now, in the heart itself, let us study. Just check over there. You got SA node, that is sinoatrial node. Then next to that, you got internodal fibers. Then from there, AV node, that is atrioventricular node. From there, you got bundle of His. Bundle of His divides into right and left branch. And these right and left branch terminates as Purkinje fibers. Right branch goes to the right side of the heart and left branch goes to the left side of the heart. So this is the overview. So we'll be starting now with location and their role. So heart generates and conducts its own action potential. You guys know which is the part of our heart which generates action potential. Come on, guys, guess it. Okay, fine. The answer is sinoatrial node. It is called as pacemaker, and our heart never stops functioning. And let us study regarding components of conducting tissues of heart. As I said, SA node, which is also called as pacemaker. Then we have AV node, internodal atrial tracts, which connects SA node and AV node. Then AV node is continuous as bundle of His. Then bundle of His divides into right and left bundle branch. And in the end, it is terminated as Purkinje fibers. See, this is an important note. It is a line directly taken from your inside textbook. So over here, walls of dash are thicker than dash. You guys need to know. See, your walls of ventricles are always thicker than walls of atrium. Do you know why? Because your ventricle walls need to push the blood out, that is towards up and down, like to the lungs and to the tissues in our lower limb and head and neck itself. But our atrium, what it does, it carries the blood only from our atrium to ventricle, so that thickness is not required. Okay, now let us study one by one part properly. So SA node, it is located in the right upper corner of right atrium. See, right upper corner of right atrium, on the right side of superior vena cava opening, that is SA node. What is its role? SA node is the pacemaker of heart. You guys know what is pacemaker? Pacemaker is nothing but which generates its own action potential. Which generates its own action potential. And it also helps in discharging and generating of impulse which are essential for contraction of heart. Pacemaker of heart, which is responsible for generation and conduction of heart. Then, okay, I'm extremely sorry. I have written it over here. I had to write this one in this node part. Okay, sorry guys. Okay. Pacemaker of the heart. You have P cells which you'll be studying later. Not now, once you crack your NEET. Okay. Next, AV node. It is located in the right atrium itself, but on the lower left corner to the upper side of coronary sinus and to the right side of interatrial septum. Okay, guys, just check over here. See, this one is your AV node over here. See, it is located on coronary sinus on the right side of interatrial septum and on the left corner of your right atrium. That is what I wanted to show the location. Then, when it comes to what is the role of AV node, it helps in transmission of impulse. Transmission of impulse from where? Which is generated from your action potential area. What is that? It is SA node. So from SA node to the ventricles, And one more important thing, in case if your SA node stops generating action potential, this AV node has capacity to generate its own action potential. So even if someone's SA node is not functioning properly, AV node will somehow compensate. Then comes internodal atrial tracts. There are three bands, that is anterior, posterior and middle. It lies on the anterior part of the heart of the right atrium, which connects our SA node and AV node. So since it connects SA node and AV node, what will be the function? You can easily guess it out. So it carries impulses from SA node to AV node. Okay, guys, carries impulses from SA node to AV node. Okay. So till AV node, you guys have known. See, over here there is continuation of bundle of phase from our internodal from AV node. We have bundle of phase. Then later on it gives right and left bundle branch. Just check it out. So next we'll be studying regarding bundle of phase. It is a continuation of AV node till our upper membranous and lower muscular portion of IV septum. There are two portions of our IV septum, that is upper membranous and lower muscular. In our lower muscular, this bundle of phase gives right and left branch. So what is the role of bundle of phase? So it transmits impulses. Bundle of phase transmits impulses from AV node to bundle branches and Purkinje fibers, which you will get in the end. Perkins or Purkinje, whatever you call. Purkinje fibers. Okay, so bundle of is done. Next we have right bundle branch. This one originates at lower muscular portion of IV septum. In the same way, left bundle branch. Even it originates at the lower muscular portion of the IV septum. But a right bundle branch pierces IV septum and goes on the right ventricles part, and our left bundle branch pierces IV septum and goes on the left bundle branch. But this left bundle branch, what it does is, it goes to the left ventricle. It gives two branches. One is on the anterior part, one is on the posterior. That is front and back of heart. There are two branches of left bundle branch. Just remember that. What is the role of our right atrium? This supplies our right ventricle. Our left bundle branch supplies left ventricle. That is through our anterior and posterior. Okay, Purkinje fibers. This one is in the end after your branches. Just look over here. See, right and left bundle branches I have already divided, and in the end they give termination of these branches gives us Purkinje fibers. So when it comes to location of Purkinje fibers, you can call it as these originate from terminal divisions of right and left branches of bundle of his. These are Purkinje fibers. So you guys must be clear with this view. First we have SA node, internodal fibers, AV node, which continues as bundle of his. Then in IV septum it gives right and left branches, and in the end it is terminated as Purkinje fibers. Okay. So what is role of Purkinje fibers? This supplies all muscles of ventricles. All muscles of ventricles. All muscles of ventricles. Okay. Then SA node, it generates 70 to 75 action potentials per minute. In the sense 70 to 75 heartbeats per minute. Indirectly what you have meant in your NCERT. Then the SA node is called as pacemaker. I already said. What is the normal heartbeat? Normal heart rate is 70 to 75 per minute. If you consider exactly, it is 72 beats per minute. 72 beats per minute. Okay. You guys must be clear the way our heart circulates our blood. So I say one thing. See here, SA node, internodal fibers from this AV node 2, which is continued as bundle of his, which gives right and left branches. These terminate as Purkinje fibers. And one more thing, you got cordia tendina. This cordia tendina are the muscles which connect your atrioventricular walls and papillary muscles. These papillary muscles lies on the base of your right and left ventricle. Remember this. This is regarding conduction of heart. In the next video, we will be studying regarding cardiac cycle. Thank you guys for watching it.